Hello, everyone. Welcome back. This is Jerry Rothkoff. I'm managing attorney at Rothkoff Law Group, an elder care law firm serving seniors and their caregiver loved ones in both southeastern Pennsylvania, as well as southern and central New Jersey. Thank you for joining us on another edition of Who's Who in Elder Care Advocacy in the greater Philadelphia metropolitan area. And I'm honored, privileged to have the esteemed Bonney DosSantos with us today. Bonney, I have known for probably close to 2 decades now, and I have a great deal of respect for and have learned a great deal over the years through Bonney. Bonney is one of the top geriatric social workers in the Philadelphia area, working for many years associated with St. Monica's in South Philly. And now she has, after 3+ decades working with the senior population, helping them navigate the long-term care issues, Bonney has taken a very welcome and deserved semi-retirement. And now Bonney is doing some freelance consulting work in the same areas. Bonney, welcome.
Good to see you, Jerry. Thank you for inviting me.
It is always great having you. And I always learn something from our conversations, and we've known each other for many years, and I know you are one of the go-to people if I'm stuck on a complicated issue with regard to services for seniors. I know who to go to, and that's Bonney DosSantos. So it's great seeing you. I hope you and your family are well, and hope you're enjoying your semi-retirement thus far. So. Bonney, let me ask you this. You've been as I already mentioned, you've been in senior care for 3+ decades. You've seen it all, you know it all, or, well, almost all. You always want to learn something new you didn't know the day before, no doubt. And that's part of the fun of retirement, obviously, to a certain extent as well, right? Learning new things.
Yes.
But let's talk about where we are today. Not so much, to a certain extent related to the pandemic, and what do you see out there? You worked in the community, specifically South Philadelphia, for many years, working with seniors, helping them navigate the issues. Where are we today? What do you think it would be the secret sauce of helping seniors navigate? Obviously, more seniors want to stay at home than ever before, helping a caregiver spouse, a caregiver child. What are the needs out there from your perspective, working in the trenches for decades?
What I would see over and over again in South Philadelphia and in suburban areas as well is that there are lots of people out there who need a little bit of help. They may not need assistance with bathing and dressing, and some of the programs that the more governmental programs are geared for, or that the home care agencies are geared for. There are just so many people out there who may need some help with shopping. They may need help with their laundry, but they can take care of their own personal needs. And I think there is certainly in the public arena of public benefits, those services are difficult to come by. In terms of the private home care agencies, they're a little difficult to provide because it's just a couple of hours here and there. And I think that's a huge gap for people. And when I started the St. Monica Elder Care program in South Philadelphia, that's one of the things that I focused on, is those little in-between things. I didn't want to reinvent the wheel because there were different programs out there, home care agencies, there were, the options and the waiver programs through the AAA, but there just weren't those little things, almost like a chore service type thing for people.
It sounds like, Bonney, and it sounds like what you have, I don't know if you would call it the same, but there are it sounds like what you're talking about more of is like an elder village or a senior village.
Yeah, exactly what those are. Yes.
Yeah, and that's kind of like what you created, at least for St. Monica's Parish members, right?
Yes.
So in South Philly, and I think the first one was set up many years ago, a couple decades ago in Beacon Hill, which is in the city of Boston.
Yes.
And there are actually some in the city of Philadelphia beyond South Philly that you're probably familiar with. But it obviously but how do we do that? I mean, so it sounds like people need help with, and I think you would agree with me, with the navigation. And people, I mean, even today, Bonnie, I don't want to get hung up on talking about the pandemic and vaccinations, but when you talk about navigation, an obvious example of the navigation is, if you're not in a nursing home or assisted living or independent living, in other words, not in some form of a long-term care housing setting, good luck for an 85-year-old to figure out how to get a COVID vaccine.
Absolutely.
I mean, that simply takes navigation, and that's what, I'm sure if you were still in your position at St. Monica's, you would probably be on that phone or online 24/7, helping your parish members schedule those appointments, right? I mean, just something like that. People need the navigation. It's great to roll out these programs, but a lot of it is simply common sense, the accessibility of these programs.
Yes. And I think, not to get totally off on the pandemic, but it has widened the navigational divide, I would say, between those who have a family member or are able to use some kind of technology, maybe even have a smartphone, and those who don't. Those, the folks where I used to make home visits, and if they needed to document something, I'd be there in the dining room going through the drawers in the dining room cabinet, finding all the documents that they needed. But navigating is huge. I remember a couple of years ago, I always go to the Medicare training programs when they talk about the new things with the changes in Medicare, and they tout how wonderful the Medicare.gov website is, and it is. But many of the people, and it's changing. That's one of the changes I see. More and more people are becoming very comfortable with the computer, and they can be shown how to use Medicare.gov. But when they first came out with that a couple of years ago, I didn't know anybody who could use a computer and go on Medicare.gov to make some of the choices that they need to make.
Yeah, I mean, it's great to have it. Not everyone has accessibility. They could live in, obviously not the city of Philadelphia folks, but if they could live in a rural area, maybe they still have dial-up. They don't have an iPhone, iPad, or a laptop. Maybe they can't afford, high-speed Wi-Fi. There's a variety of reasons why, of course, or disability. Maybe they're legally blind. I mean, there's obvious reasons why or maybe they have Parkinson's or ALS, or maybe they suffer a stroke and they can't obviously adequately use a keyboard, for example. So there's a variety of reasons, either due to disability or due to lack of resources, while someone doesn't have the accessibility that maybe others have. So certainly you're creating a further digital divide, not just among all populations, but certainly among seniors as well. But on a bigger scope, what do you, in your years working with the senior population, can you talk about some of the evolution and changes in your own duties? What have you seen some of the biggest differences from when you started out your career and dedicating it to working with seniors through within the past year when you retired? How has your role changed? And when you reflect upon that, what other changes do you see that are needed out there?
I think systems have become more complicated, probably. There have been major changes in how Medicaid is administered through the managed long-term supports and services. I think, and again, most of my experience is in Philadelphia, but it used to be fairly simple. You could call the area agency on aging, and there were 2 or 3 different programs, and you'd get pointed in the right direction. And that has gotten a whole lot more complicated, and there have been more layers. with the managed long-term supports and services and the MCOs, and you have different Medicaid providers providing the care management for those of limited means. I think there have been great advances in the types of technology that can be used with the emergency response systems and fall detectors, and telemedicine, I think, has been wonderful. I think the technology that they've been able to fit stair glides into smaller areas, and Hoyer lifts that are kind of have a hydraulic track going around on the ceiling. Technology has been wonderful in helping people adapt their homes, I think, to be able to stay in their own homes.
But do you think, obviously, like anything else, technology has its limits for a variety of reasons? Not because necessarily you use the human touch, but it has to be affordable.
Yeah.
And it has to be accessible to the masses. I mean, it's great to, I guess, to have all this exciting technology with the robots, and some of it is accessible. A lot of people don't think about it. I mean, for example, for the most part, I'm assuming like something like Amazon Alexa, that's obviously available to the masses, but it can open up a whole host of possibilities out there, especially for those who are seeing impaired. So it can, so of course you need someone to facilitate that program, and et cetera, et cetera. But something like that obviously is semi-affordable, that it is open to the masses for the most part. But other technology is not. But what, I guess, and one of the, I guess, and you're right about the bureaucracy. I mean, bureaucracy is important. The saying is, other than the Nuclear Regulatory Administration, or industry, I should say, the nursing home industry is probably the second highest regulated industry in the country, which is both good and bad. Obviously the regulations that protect consumers, but you're right. I mean, I try to, I mean, even I've been doing this for 20 plus years, and to try to navigate the Medicare and Medicaid system, you might as well be speaking, some type of foreign language that you never heard before, because that's kind of what you're getting. It's archaic. I mean, I spent 3 hours the last week trying to put together the pieces of what program this individual who's in a Medicaid HMO you refer to is in. So, and I'm trying to understand, it was an Obamacare program, but yet you're getting 50 hours plus of personal care services. And in other words, what Medicaid door did this client enter?
Yes.
And I had to piece together and make all these calls to the MCO to understand exactly what was going on. It doesn't need to be that way. And so, government regulation is good, but it can be bad. And I'll give you another, one of the examples I point to, because is that the government, it can inhibit creativity, ingenuity. I was in Israel about 3 years ago studying the healthcare delivery system throughout Israel for Jews, Muslims, as well as Christians, and it was a fascinating tour. And one of my conclusions I walked away with is that Israel can be much more creative, or have much more ingenuity with their long-term care programs, because there's a significant less regulation, which is, again, it depends on what side of the aisle you sit on. But in here, as I'm sure there are concrete, like I guess barriers between what is independent living, what is assisted living or personal care, what is nursing home care, what is skilled care. And depending on which door you're in, it go through, it depends on what the reimbursement is. And it's static. And in Israel, it's kind of a gray area. And so people can kind of move and go between different areas and the reimbursement stays the same.
Uh,
So I think that's one of the issues is that, and is going on. So what do you see the future? Tell me with your experience and the few minutes we have left, what do you see is the needs out there with the population that you've served for several decades? Can you give me one or two bullets of what is needed? Is it more community-based programs out there? Is it serving people more in a home setting? Or is it the navigation that you alluded to earlier and having more people like you out there?
I think the navigation is going to be key for whatever direction people go. But I think more home and community-based services, there's definitely going to be a caregiver shortage, I think, as the baby boomers age. So, and I think another negative aspect of the pandemic is it seems like fewer people are going to be more reluctant to go into long-term care because they're afraid of not being able to see their family members if this happens again. So I think the movement is going to be increasingly, I think the pandemic accelerated the movement for people wanting to age in their own homes. I think what is needed is more reliable transportation for people who have disabilities. That's limited. And again, that's kind of fragmented, how much you make and if you're in a Medicaid program and how you qualify for different types of transportation. But I think key is the navigation and what Rothkoff law does with the care coordinators. I think there need to be more care coordinators. The services seem to be out there. Sometimes there are not enough of them, but they're so hard to access in many cases that I think navigation, having somebody to help get those services is going to be more and more important going forward.
You're singing my song. So, and feel free to say it again.
Okay.
And so, but I hear you, and I thank you for those comments. But of course, it's just getting people on board. It's related to reimbursement, because it's great to say you need the navigation, but who's paying for it? Who's paying for these navigators? Hospital systems have navigators, but hospital systems have navigators for their own selfish reasons.
Yeah.
They're not doing it. I mean, I wouldn't say they're doing it in an altruistic fashion. They're doing it, I guess, because they think it's the right thing to do. It's the right thing to do because it pads their bottom line. With penalties for readmissions and such. You know what I'm referring to. So they wouldn't do it if they couldn't figure out that it benefits them financially, as opposed to it's just the right thing to do.
Yeah.
So so I think just think about it. I'm sorry. I don't. You've known me for many years, and you probably know me by now. I have lots of complaints, and this just will end. I mean, it's just very simple. One of the things we talk about the vaccine rollout. You mentioned, well, why don't we do things more on a local level because people are more trusting, especially seniors who are, for a variety of reasons, are very not that they're untrusting, but they're apprehensive. So think about it. What type of doctor do most people see on a regular basis?
I see their primary physician.
Right, primary care physician who knows them well. In many cases, it's a small community type of practice where they've been around a long time. And so, where do people go for flu vaccines on a yearly basis? They go to their primary care physician. So why on God's great earth would not the federal government via the states or the localized township or city where you live, why wouldn't there be some participation of primary care physicians in the vaccine rollout, as opposed to having having seniors who live in a community have to go online to register at area, and they're fighting, and it's kind of like a dueling keyboard challenge between a 25-year-old and an 85-year-old who's going to get that appointment. So why wouldn't that primary care physicians be involved in the rollout? So just like you would go for an 85-year-old would go to their doc for their flu vaccine. Why couldn't they get I mean, I understand there's practicality. Why couldn't they get the vaccines? I understand there's limitations with obviously being stored at very cold temperatures. I get that, but that's always a reason to say no. There's ways to make it happen, I think. You know, there's barriers, you know, but I don't know. Just another thing that just needs it seems so simple, but why does it have to be this complicated?
I know.
So, all right, enough of my complaints. So that 15, 20 minutes has flown by as I expected. So I thank you so much for your time, Bonney, and thank you for your contribution to the advocacy of seniors and all your services over the past decade. Has been truly needed, and we thank you for all you have done for seniors and their caregiver families and friends. So thank you for your time. Thank you for being an inspiration to all of us, and thank you for your dedication to the senior population.
Oh, well, thanks, Jerry.
Okay.
It's always a pleasure to talk to you. Thanks for all you do.
Well, you're very kind. Thank you. Pleasure. Thanks for your time.
Okay.